The Importance of Nursing and Their Roles and Responsibilities by Mariah, Marissa, Ursel, and Skylar. What do you think of when you think of nurses? Do you think of people who wear scrubs that come in to check on you or may even take your vitals and give you medicine? Or maybe even change your bedpan? Although nurses do that, there is so much more that people don't realize about them. Nurses must go to at least 2 to 4 years of schooling just to become an RN, which is also known as a registered nurse. Once they have the RN, they have the opportunity to become a higher skilled nurse, which could be a BSN, Bachelor's of Science in Nursing, which takes 4 years, or even an NP, which is a nurse practitioner. A nurse practitioner is a nurse that has a master's degree in nursing and works under the supervision of a physician. This is the highest skill level of nursing. Under each of these different types of nurses, there are many specialties, such as cardiology, neurology, and OBGYN, just to name a few. Something that all specialties have in common is patient care and documentation. The nursing profession is so vast and broad, it is almost impossible to name all the titles and describe all of their roles. Each specialty requires a different type of training. Although the nurses may have an RN, BSN, or MSN, they must still train for their specific specialty they go into. Nurses can also work in many different types of places such as home health care, hospitals, clinics, or even nursing homes. No matter the type of nurse, nurses play such an important role in the medical field. Over the next few minutes, you will be introduced to 4 specific types of nurses: spinal cord, psychiatric, ER, and oncology. We will discuss the importance of each and what their role is. Spinal cord nursing is a collection of various nursing roles combined into a complex role. A spinal cord nurse's duties are similar to the role of a medical surgery nurse as well as a nurse that works in geriatrics. As a spinal cord nurse, you may deal with patients who had injuries to the spinal cord that may make them paraplegics or quadriplegics. Patients who have spinal cord injuries sometimes obtain complex wounds that may be staged and packed. These wounds are staged and diagnosed. There is a lot of wound care that is involved with patient care. Spinal cord nurses also have the duties of taking care of patients who are on ventilators and cannot breathe on their own. A lot of spinal cord injury patients have lost their ability to use the muscles from the neck down, so the ability to use the muscles that help the chest rise and fall are not functioning. Spinal cord nurses also deal with bowel and bladder excavation. Also stated before, depending on the location of the injury on the spinal cord, patients may have problems with bowel and bladder elimination on their own. It is the duty of the spinal cord nurse to assist the patient with elimination. Nurses have the task of manually assisting patients to evacuate their bowels and bladder. The most important thing about bowel and bladder excavation is keeping patients from going into AD. AD is a condition that spinal cord patients can develop that can cause the patient's blood pressure to rise to stroke levels, the pulse to rise, and the patient to sweat and feel faint or weak. It is the nurse's job to be aware of the signs and symptoms of AD to protect their patients. The nurse must access the patient, aid, and treat them immediately to make sure everything is functioning properly. Spinal cord nurses play an important role that not many other nurses could do without being trained, unlike other specialties where nurses could probably do some skills they learned during their rotations in nursing school. A psychiatric nurse also has an important role in nursing. Having the role as a psychiatric nurse can be very challenging because they handle the diverse needs of patients who suffer from mental distress and mental disorders such as psychosis, schizophrenia, depression, and bipolar disorder. Psychiatric nurses share the same occupational focus and duties as other nurses, but they work with patients with various mental and behavioral conditions. This requires focus on patient interaction. Psychiatric nurses are usually assigned a caseload of patients and provide direct patient care, which include facilitating social and emotional needs, supervising medication schedules, and evaluating patient progress. A psychiatric nurse collaborates with the interdisciplinary team to determine and provide the best possible care for these patients. Many patients are hospitalized because they are a danger to themselves or others. Psychiatric nurses are responsible for maintaining a safe environment throughout the use of monitoring devices and restraining techniques when necessary. Psychiatric nurses provide social support for patients by encouraging patients to participate in support groups, social activities, and other therapeutic measures. Psychiatric nurses work in a variety of environments that include hospitals, mental health facilities, outpatient clinics, and many more. A person's mental illness does not have to influence the lives of the patient and their families in a negative way. Helping the patients deal with their illness is at the center of their work. Like a psychiatric nurse, an ER nurse is also very challenging. Being an ER nurse is probably one of the most fast-paced and high-pressure types of nursing there is. An ER nurse can be an RN, BSN, or MSN, much like other specialties. ER nurses work in the emergency room dealing with either whatever the ambulance brings in or whoever walks through the emergency department doors. They deal with trauma and must think on their feet because trauma doesn't wait for anyone. With the environment of being so fast-paced, ER nurses must be able to think well under pressure while still making rational and well-educated decisions and being able to do certain skills. ER nurses have a wide range of patient care. They treat anyone from non-life-threatening to life-threatening within minutes of each other. Unlike many other specialties, ER nurses treat all ages. There are where others may just treat a specific age range. ER nurses don't really get the chance to build relationships with their patients like other specialties do because they only really see their patients for a few hours at most. Then their patients are out of the ER whether they are moved to inpatient or discharged. Unlike ER nurses, pediatric oncology nurses have a specific age range they treat, which is young patients with cancer. They give treatments such as chemotherapy and radiation therapy. Their goal is to help administer the medication in the treatments that will get rid of as many cancer cells as possible. Delivering chemotherapy is not only affecting the patient, but also possesses hazards to the nurse administering the medication. These nurses must take precautions every time they administer any type of medication that they give during chemotherapy treatment. They take these precautions by wearing protective mask, gown, and gloves, also known as PPE. Not only do the nurses have to take precautions for the medicines, but they also have to be careful about spreading germs. Patients receiving chemotherapy have extremely weak immune systems, which can result in social isolation. In these cases, pediatric oncology nurses must suit up just to check on the patient. Although pediatric oncology nurses have a very rewarding job, they also have one of the hardest. Every type of specialty experiences death, but pediatric oncology nurses build relationships with their patients for possibly months or even years at a time, depending on the patient's stage and type of cancer and treatment process. Many times their patients become very sick, sometimes from the treatment, the cancer, or both, and they pass away. A pediatric oncology nurse must have the dedication and understanding to work with many patients with terminal illness. In conclusion, nursing is one of the most sought-after professions in the healthcare field today. There is an expectation that nurses are to show compassion and attention to detail with every patient that is in his or her care. Patients can be very demanding, especially when they are not feeling their best or are in a lot of pain. As a nurse, it is always important to follow the doctor's orders as they may change frequently due to the needs of the patients. Nurses have a lot of tasks that need to be done in a day, and each one being just as important as the other. In this speech, we went over some roles of nurses that we each aspire to be or already are. If you decide to become a nurse, it offers the opportunity to work in a very rewarding career in healthcare.